ANA Position Statement on Nursing Care and DNR Decisions. Hello. Today we're going to be talking about the American Nurses Association Position Statement on Nursing Care and Do-Not-Resuscitate, or DNR, decisions. This video is being brought to you on behalf of the ANA Center for Ethics and Human Rights. Ethics Advisory Board members Drs. Heather Fitzgerald, Nelda Godfrey, and Catherine Schrader contributed to the drafting and production of this position statement and educational video resource. We are pleased you're with us today to learn more about this important position statement from ANA. The purpose of this position statement is to provide ethical guidance for nurses and do not resuscitate, or DNR, decision-making processes, and make recommendations for clinical and policy change. Situations where do not resuscitate decisions must be made can be difficult. For that reason, it's important to understand the guiding principles from ANA on how to look at such a situation. Nurses advocate for and play an active role in initiating discussions like this with patients, families, and members of the healthcare team. Care for patients with do not resuscitate orders is no different than the care for any other patient. In fact, it's important that patients with DNR orders not be abandoned, or that any diminishment in the quality of care should not occur. And this is reflective of the high value nurses hold about a holistic view of patients and families. And it prepares them to collaborate with members of the healthcare team, the patient, and other family members, so that everyone can make informed decisions. There are 4 chief ethical considerations in this situation of do not resuscitate decisions. 1. Nurses must establish relationships of trust and provide quality nursing care. Secondly, nurses actively lead by participating in the appropriate interventions. Third, nurses truly respect the patient's right to self-determination. And fourth, nurses are well equipped to foster collaboration and open communication among all members of the healthcare team. Nurses also advocate for appropriate organizational policies. Why? Well, because patient wishes are central and must be considered. Again, the right to self-determination. Secondly, organizations work better when there is collaboration, and that leads to better informed decision-making. Third, evidence-based approaches are a tenet of nursing practice, and it's important that we are aware of interventions that are based on research, but also consider individual patient differences. And fourth, one must be aware that DNR decisions may pose ethical conflicts or cause moral distress for the nurse. In situations like this, it may be necessary to allow for transfer of care to another nurse if necessary. There are a number of issues about the terminology involved in this position statement. DNR is sometimes interpreted as DNI, DNIA, and there is great confusion over the acronyms and abbreviations that surround this topic. Further, the confusion increases because the abbreviations and acronyms may vary among institutions and also may vary in different regions of the country. So the question becomes, how acceptable are these terms? And our recommendation is that we stop using acronyms and start being more clear about what we are trying to communicate. A second issue is that there is growing evidence that comorbidities negatively influenced resuscitation outcomes. And DNR orders are not simple, because in fact, do not resuscitate orders are routinely reconsidered when surgery is needed. Therefore, it's not always a make this decision and stay with it. It may depend on the circumstances of the patient. So given the complexity of this particular position statement, we are sharing 4 recommendations. And after these recommendations, there is a case study that you can use with groups of nursing students, practicing nurses, or nurse leaders to go through the prospects of what one should consider when providing nursing care in do not resuscitate situations. These 4 recommendations are: 1. Nurses respect human dignity as they support patient wishes. 2. Nurses assure responsibility and appropriate interventions, and these interventions meet or exceed the standard of care. 3. Nurses advocate for an interdisciplinary, collaborative, and open communication approach to the do not resuscitate decision-making. And lastly, nurses seek to learn more about the evidence and best practices associated with do not resuscitate orders. So here's a case study about do not resuscitate decisions. and how one provides nursing care. Mr. L is an 86-year-old male who was admitted to your telemetry unit last evening with a diagnosis of possible acute stroke, coronary artery disease, hypertension, and type 2 diabetes. He is alone, and he pulls you aside and says, "I don't want any heroic efforts to be carried out on my behalf. I've lived a good life and I just want to go home to heaven." So here are some questions that might guide your thinking and your conversation. What questions do you need to ask in order to communicate to Mr. L that his wishes are truly valued? Secondly, what strategies do you need to implement so you ensure that his wishes are considered? Thirdly, who do you identify as key people who need to be involved in the next steps of your nursing care? And fourth, what are the key components of communication that you will need to use when communicating with Mr. L's healthcare team? I hope you find this case study interesting and that it will generate a good deal of discussion about a difficult, important, and sometimes complex topic. To view the full position statement and references, go to nursingworld.org/ethics. Thank you for joining us.